little nervous, kind of anxious, but
I feel like all those thousands and thousands of prayers will pay off right now.
yeah. Hopefully those will come through and I'll feel a little bit of peace. So here we go. Hi everybody, today is a big day and I just wanted to sit down and talk with you for a few minutes before I head into the hospital. I am going to be doing my big surgery today. It includes the port removal, the bilateral mastectomy, and the removal of the tumor in my lymph node. Just kind of wanted to let you guys know where I was at mentally, emotionally, physically. I would be lying if I said that I have been doing really well lately. The past few days have been really challenging for me. There is a lot that's been going on in my mind as I prepare for this big surgery. A lot of unknowns, a lot of questions, and it has been hard. I first wanted to start off with talking about the port. So initially before starting chemo, I got my port placed. It is on the right side of my chest, so it is right over here. It's under my skin, and there is a catheter basically that goes to my large vein right here, and that is what the chemo is administered through and is how the medication gets in my body. So I didn't really talk about this in the beginning. I was healing from my surgery for a long time, and then we just got in the routine of going to my treatments. So I did want to kind of talk to you about that. There was a 9 to 10 week recovery. It was really hard to move my neck from side to side when I first got it placed. I felt like it was pulling right here and it was really uncomfortable. Now it's kind of become a part of me. Like I forget that it's there, but initially when I first got it, I was like, I don't know how I'm gonna move my arm. I don't know how I'm gonna do yoga. I don't know how I'm gonna work out. And then obviously it kind of calm down a little bit. So as far as getting it removed, they said that there will be a horizontal scar that'll be on right at the top part where they did do the sutures. It shouldn't be too big, but that was my initial question is, well, it's stretching my skin out, so what is it going to look like when they take it out? And she said it'll just go back to normal and it'll be fine. So they're getting that removed today. After I get the tissue taken out, the bilateral mastectomy done, plastic surgeon is going to be putting in expanders, and that will stay in there for probably 6 to 9 months depending on when my reconstruction is. With the post-procedure, I will have drains that will be on either side of my abdomen. They will be under the skin, under my breast, and the tubes will come out through a hole. There will be little bulbs that are attached on the bottom part, and during the healing process, that is when my body is getting rid of all the fluids, and so they need a place to drain, otherwise there would be a lot of inflammation in my chest area. So those will need to be drained every 2 to 4 hours for the first 2 to 4 weeks, and then after that I will get my drains out, and then I will follow up everything with radiation. We don't have the information on radiation yet, how long that will be and what that'll consist of, but we will keep you updated with that. But I did just want to briefly go through and let you know kind of the questions I have going into this procedure and what to expect, and the reason why I chose to do a double or a bilateral mastectomy over a single. The reason I chose to do the double is because it does give me a better prognosis and lowest chance of recurrence. There are really good statistics showing that there is low chances of it coming back. There is always a possibility, but with a majority of the tissue removed, there should be a very low chance of cancer coming back to that area. So that's why I chose to do a double mastectomy over a single. Another big thing that we had talked about was if I was able to do a skin sparing mastectomy and if I was a good candidate for that. And as far as I know, I think we will be able to spare the skin. My surgeon is really optimistic about that. Obviously, we won't know until we go in and we actually see the tissue and the areas that were compromised due to the cancer cells. That is an option, but we don't know if we'll be able to do that until we'll be in there and the doctors can look at the tissue. Another topic we had talked about was if we were able to do a nipple sparing mastectomy, which would be keeping my nipple, and again, that depends on how close the cancer was to the nipple and if it is too compromised to keep it in my body. Obviously, I don't want to keep anything that my body doesn't need and doesn't serve my body, and if it's too compromised, then I am all for getting the nipple replaced and doing a tattoo. I think what I'm having difficulties and challenges with is preparing for a worst case scenario and hoping for the best. And that could be not doing skin sparing and taking me completely flat, removing the nipple, and then waking up and being like, oh, I could save the nipple and I could save the skin, and that's not what I have. So I think it is just preparing for the unknown that's giving me a little bit of nervousness and anxiousness. But again, I am just like grateful that we have had the tumor shrink a good amount with chemo, and we are able to do what we can with the surgery. So I'm really hopeful and optimistic for that. But it is very nerve-wracking going in not knowing what to expect. They did say that my range of movement will be basically this for the first 2 to 4 weeks, and I'll need a lot of assistance in doing just the small things around the house, like brushing my teeth, getting out of bed, going to the bathroom, those small simple things that we kind of take for granted sometimes. My mom is here and Dylan's here, and I have a really good support system behind me, so I think we'll be good there. But I just wanted to share a few of those thoughts with you guys. I think it's normal to kind of question what the outcome is and kind of how things are going to be, what our bodies are going to look like after going through something like this. And I'm sure if you've gone through cancer, you have felt this too, but I think it's important to share that this is the reality of the situation, and it's okay to feel nervous and anxious and scared and have a lot of questions going into something, a big procedure that is, gonna change the way your body looks and not really know what to expect. Just wanted to share a few of my thoughts with you guys today, and we will try and kind of give you a little bit behind the scenes of the surgery so you kind of know what things look like and how it is. I feel a need to share that with you guys since I've shown all the other parts, and I just think it is helpful for people who might be going through this or just get a cancer diagnosis and don't know what to expect. So I just got to the hospital. Today is my surgery day, and they just did an IV in my arm right over here. So they put the IV right here, and this is linked to the machine up here that's giving me some medications. They started an antibiotic, so it helps prevent infection, and I go back, and then they gave me like a drip that has water and electrolytes in it since I haven't eaten or drank since last night midnight. And then I'm just waiting for my surgeon and my plastic surgeon and the anesthesiologist to come in and talk to me before they take me back to the surgical room, and we're scheduled to have like a 5-hour surgery. So we will see how that goes.
It'll go great.
A little nervous, kind of anxious, but
I feel like all those thousands and thousands of prayers will pay off right now.
yeah. Hopefully this will come through and I'll feel a little bit of peace. But we're just waiting for the doctors to come in, and then I'll be in the recovery room after surgery for probably about 45 minutes, and then I'm for sure staying overnight tonight, and I don't know if I have a second night of overnight, but we will find that out as soon as we finish. So here we go.
So we just left the hospital, and they just wheeled her back in. She handled her chemotherapy treatments like a champion, honestly, and really didn't get emotional until the last day, and where she was more crying out of joy and relief. But this is a little different. She's just knowing that she's going back there and she's by herself and she's scared. And she's so uncertain of what's going to happen from this. This has been by far the hardest part of the journey for her as well. You've really, truly amazed the world, and you've amazed me at how you've handled this. You have an amazing story, and you're going to have an amazing story to tell. And I'm just so proud of you, and I love you so much. There she is. She just woke up. Babe? Hi. How are you feeling?
I'm in a lot of pain. Chest is really sore.
Yeah, you're gonna be sore. They have her all hooked up, and we'll kind of go through on a different time and show you guys what. She's got drains on both sides, and she's on some morphine right now, and the nurse is coming and checking on her every hour. We're gonna spend the night tonight, and hopefully we can go back home tomorrow. And the surgery went really well, and we'll give you an update on that. But do you guys know anyone else that looks this beautiful in a nightgown, in a hospital gown? No makeup, just pure beauty.
Thank you, honey.
I love you.
I love you.
So Delia had to spend an extra night at the hospital, and we thought we were gonna be back yesterday. So I came home to go pick up some groceries for her, some fruit and vegetables. And I'm actually heading back to the hospital to pick her up right now. And so I thought we would just show our girl how loved she is and how strong she is. So I was really just out decorating her room a little bit. Hope she likes it. So just getting ready to go home. Just got back here to the hospital, and she is ready to go.
Yeah, I just spent my second night in the hospital, and I was having a lot of pain yesterday, but it's a little bit more manageable today. So the doctors have been switching out Tylenol and ibuprofen. My surgeon came in and looked at my incisions and said everything was looking really good. I was having a little bit of blurred vision from the medication, that's gone down a little bit, and then from the breathing tube that was put down my throat, it's like messed up my voice a little bit, but I think it's getting a little bit better. And then they want me to try and walk like 4 times a day because I need to get blood circulating. They have these like pumps on my calves that like help.
They basically just pump
keep
blood
circulation
back up.
so I don't get any blood clots or anything like that because I have been laying down for a little bit. So it alternates and pumps one leg and then the other.
Gives her good calf muscles too. And look at her hair. Look how fast it's growing.
It's dark, huh?
Got little sideburns. It's looking good.
And then I don't know if this is gonna gross you guys out, but this is just what's going on. So I have these little drains that are on this side and on this side, and it comes out. They're
fluids.
Don't pull too hard.
So that's kind of being drained from her chest, and these are coming out like her sides
so it
right
comes
here.
out of this little, I don't know if you can see it, this little incision right there. And it's on both sides, so those have to be drained every 4 to 6 hours. And that hurts so bad when they strip this part. So like they like squeeze it and like try and push it in to the drain part more, and it like pulls, it like suctions my chest, and it hurts so bad. They want to do that so it doesn't get any clots, and it keeps draining, otherwise my chest will be swollen.
Oh, and she had her nails done.
Yeah, I got my nails done like.
Look how good they look. She's excited to get those done after chemo.
I was so excited that this is my second set I got in like a week and a half, because I knew I wasn't going to be able to go. I'm going to be in bed for probably 4 or 6 weeks. So.
Well, at least it's get to be your own bed.
Yeah.
So we'll be out of here in a few minutes. Once they teach me the regimen, all the pills and stuff she needs to take.
You can show they took the port out right here.
Oh, yeah. Yeah, they did take her port out.
Right
so
there.
She's got just a little scar there, and that'll heal nice. It's actually really smooth already.
It is smoothed out?
Yeah.
I still haven't looked at my chest because I just...
Yeah, I wouldn't look at it yet. So her chest right now, she's got expanders in, but it's super lumpy right now, and the scar is about like, it's almost like an inch thick of, did you know that? Like scar tissue, but it'll go down. And the surgeon came in and actually looked at it and said, this is really, really clean, and this will heal very nicely. And we had amazing surgeons, both the plastic surgeon and the breast surgeon.
The doctors told me that we most likely would be able to do a skin sparing mastectomy and spare the nipple, and she said hopefully, but if there was something that was compromised in the tissue, she wouldn't be able to. And they were able to save all of my skin and both nipples on both sides, so I don't even think they took any of the skin.
That's awesome.
And so she was really happy about that, and she took out all the lymph nodes in my left axilla, and there's still some that are up here, but under the arm they're all removed because 3 of them had cancer cells floating around. So she wanted to take more than leave some in there that could potentially regrow or whatever. So totally really sore, and I'm just having a lot of pain on this right side.
Yeah, they had her on a lot of pain meds, but the hardest parts are now over. Chemotherapy is done, surgery is done, now just radiation, getting through this, recovery, and then reconstruction.
Mm-hmm.
And our woman is surviving.
She said I need to be like moving my arms so I don't have T-Rex arms.
T-Rex arms?
Yeah, 'cause sometimes they don't move their arms. It does hurt.
That's my little T-Rex.
Because I was under anesthesia for so long, they want me to rework my lungs and get them working like full speed again. So I have to do 10 inhales of to my breathing machine every hour, and the goal is to get to 2,500, and I only can get to 1,000.
This is like the carnival. She gets the huge teddy
time-
bear if she gets up to the 2,500.
Every time I laugh or cough, it hurts.
All right, see if you can do it, babe. Go.
I can only get to like 1,000.
No, you can do it. Come on. Okay. Deep breath. 1,500. You got it. Oh, that was close.
What is this? Oh my gosh. We went all out with everything. I just got home from surgery and came home to this big surprise in my bedroom. 5 million flowers everywhere. Thank you. That's so sweet of you. So beautiful. Thank you.
Honey. You're so glad mommy's home. Look at him.
Somebody missed his mama. Did you miss your mama, honey? I love you.
So what I didn't realize when I put all the balloons on the ceiling is that she has to have the fan going. So yeah, we had to move the...
It's okay. They're still pretty in the corner.
Honey, come here. He thought this was a toy for him.
Is your toy? Did you find a new toy?
That's mommy's pillow.
Did you find a new toy, honey? You love it?
Give me that. Give me that.
Do you love it? One. Ready?
Ready.
Launch!
Hey!
I can't believe you just did that!
This is sweet.
It's never gonna fly.
Now let me show you something.
It's whirlwind.
That's never gonna fly. But it'll float. See? You didn't even realize you made the world's coolest boat.
Thank you, Daddy. You always make it.